Hello guys, so today we shall be discussing regarding the muscles of facial expression. Okay, our topic of discussion will be muscles of facial expression. So if you see that there are different kinds of muscles, okay, there are many different muscles, right, many number of muscles actually in the facial region. So we shall discuss one by one what are these muscles. First of all, we shall divide these muscles, okay. So before we divide these muscles, one very important thing you need to know is that where are these muscles located. So all these muscles of facial expression are located in the subcutaneous tissue of your face. So this is your skin. Beneath your skin you have got the subcutaneous tissue, right, that is the fat, and beneath that you have got the muscle. So this chunk which I am catching right now, this is the muscle, right. So this again, this is one of the muscle. Again you have got muscle over here, muscle surrounding the eye. So all these muscles whatever are there here, right, so these are located in the subcutaneous space of your face, okay. So these muscles are located in the subcutaneous tissue of the face, subcutaneous tissue of the face, okay. So they are located in the subcutaneous tissue of the face. Now after that, the second important thing you need to know is that from where does these muscles originate. So you need to know that these muscles originate from the bone or the fascia, okay. And where do they insert? They insert to the skin. So these muscles, they originate or they arise from the bone or the fascia and they insert to the skin. They insert to the skin. From where does these muscles usually develop? All these muscles, they develop from the second pharyngeal arch. So all these muscles, they develop from the second pharyngeal arch. They develop from the second pharyngeal arch, right. Now all these muscles are innervated by the facial nerve branches. So there are different branches of facial nerve, right, like zygomatic branch, frontal branch, buccal branch and all, mandibular branch. So there are different branches of the facial nerve. So all these branches of the facial nerve are innervated by the muscles of the facial expression, right. So all these branches, they innervate the muscles of the facial expression. So all are innervated by the facial nerve branches. Facial nerve branches. All are innervated by the facial nerve branches. Now, second important thing over here is that if you look at the facial muscles, what are the different groups of facial muscles we have got? So facial muscles are overall, the facial muscles are divided into three important groups, okay. So what are those three important groups? One group is called as the orbital group, right. I mean the facial muscles that are located around the orbit, the facial muscles that are located around the nose, and the facial muscles that are located around your mouth, right. So the orbital, these are called as a orbital group, these are called as a nasal group, and these are called as a oral group. So your entire facial muscles are divided into three groups. One is called as your orbital group of muscles, second is called as your nasal group of muscles, and third one over here is called as your oral group of muscles. So how many groups we have got? We have got three most important groups. So one is called as your orbital group, next you have got is the nasal group, and third one over here is called as your oral group, okay. Now when it comes to orbital group, within the orbital group there are two different muscles. Within the orbital group there are two different muscles. The first muscle is called as Orbicularis oculi, not Orbicularis ori, in the sense the oral cavity. I am telling Orbicularis oculi, ocular in the sense the eye. So Orbicularis oculi, okay. Now if you look at this Orbicularis oculi, within this Orbicularis oculi also there are three parts, okay. So for example, if you look at the muscles that are surrounding the eyeball like this, these group of muscles are called as orbicularis oculi. So why I am calling it as group of muscles, because this orbicularis oculi itself is having three muscles, right? So this part of orbicularis oculi, which is just above the upper eyelid and below the lower eyelid, this muscle over here is called as the palpebral part. Next, the orbicularis oculi muscle, which is located on the two corners here and here, this is called as the lacrimal part. And third important thing is, the rest of the part is called as the orbital part. So how many parts we have got? We have got three important parts. So these three important parts are, one is called as the palpebral part. One is called as the palpebral part. Another one is called as the orbital part. Palpebral part, orbital part, and third one over here is called as your lacrimal part. Lacrimal part. So in this way there are three groups of orbicularis oculi. And after orbicularis oculi, the next group of muscle we have got is corrugator supercilii muscle. What is this? Corrugator supercilii muscle. Corrugator supercilii muscle. Okay. So corrugator supercilii muscle and orbicularis oculi muscle, these are the two facial muscles which are related to what? These are the two facial muscles which are related to your orbital part. Okay. Let us look at these muscles now. First is orbicularis oculi. So this muscle over here is orbicularis oculi. Now in this orbicularis oculi muscle, as I told you, how many parts? Three parts. See, this part which I am drawing right now, right? So this part is called as the palpebral part. You see this part over here, which is attached to the superior palpebra, which means upper eyelid, inferior palpebra, which is called as lower eyelid. So this is called as a palpebral part. Next, here you have got another part. This is called as the lacrimal part, and the rest, whatever you can see, is called as the orbital part. Okay. So what are the different parts over here? See, this part over here is called as your palpebral part. Right, and this one over here is called as your lacrimal part, and the rest you call it as the orbital part, and the rest in the sense the remaining part. You see this the remaining part, whatever you can see here, all this is your orbital part. Okay. Now let us see what is the use of this muscle. Okay, first of all, when I talk about the use of this muscle, first of all let me write down what is the use of the palpebral part, what is the use of the lacrimal part, and what is the use of the orbital part. So there are three parts here: palpebral part, lacrimal part, as well as orbital part. So what is the use of these individual muscles over here? First important thing is that palpebral part. What is the palpebral part useful for? Palpebral part is useful for gentle closure of the eyes. See, for example, if I wanted to close my eyes, I am closing my eyes like this. So this is called gentle closure of my eyes. So this closure is called as tight closure of my eyes. So if I am closing like this, this is called as a gentle closure of my eyes. So it is responsible for the gentle closure of your eyes. Okay. What is the lacrimal part? The lacrimal part here, when it contracts, the lacrimal gland releases what? Lacrimal fluid, which will pass into the nose. So it is responsible for the release of the lacrimal fluid. So it is responsible for the drainage of the tears. The lacrimal fluid is nothing but called as your tears. What is the orbital part? Out of these three parts, which part is a bulky part? The orbital part is a bulky part. So that is why orbital part will have the major strength. So orbital part is responsible for tight closure of your eyes. So it is responsible for the tight closure of the eyes. So there are three types. One is called as palpebral part, useful for gentle closure, orbital part responsible for tight closure, and lacrimal part is responsible for the drainage over here. Okay. Now, after the discussion of the orbicularis oculi is done, the next muscle we will go is corrugator supercilii muscle. So, what is corrugator supercilii? See, this is the muscle that is located behind the orbicularis oculi. So, all of you know that this particular muscle is your orbicularis oculi. Behind this muscle, you see this muscle, right? Very clearly, if you have to see, I will remove the orbicularis oculi. After removing orbicularis oculi, this is how it looks. You see this particular muscle over here, this is called as superciliary muscle. Okay, what is this? This is called as corrugator supercilii muscle. Corrugator supercilii muscle. Okay, so what are the two different muscles which we have discussed so far? One is called as the corrugator supercilii muscle, and the next one over here is called as your orbicularis oculi muscle, right? Now, what is the use of this corrugator supercilii muscle? For example, when this corrugator supercilii muscle is contracted, what can happen? What can happen is that whenever this is contracted, you see, this is how the contraction happens. Whenever this is contracted, what will happen? Both the eyebrows, they come together. Okay, when both the eyebrows they come together, you're gonna see a vertical wrinkles. For example, whenever someone is serious at you, right? So obviously they bring both their eyebrows together in this way. When they bring both their eyebrows together, you see vertical lines in between, right? So these are called as vertical wrinkles. So these vertical wrinkles are what? These vertical wrinkles are formed by your corrugator supercilii muscle. Okay, so let me show you the picture also. So you see here, both the eyebrows are brought together. As a result, you see what wrinkles over here? Vertical wrinkles. Okay, so what is the action of this muscle? What is the action of this muscle? And by the way, where is this muscle located? This muscle is located posterior to your orbicularis oculi. Okay, posterior to your orbicularis oculi muscle, posterior to your orbicularis oculi muscle. Right. Let us discuss about the action which we have already talked. Let us just write it down now. That this muscle draws the eyebrows together. Draws the eyebrows together. So as it is drawing the eyebrow together, what wrinkles are formed? Vertical wrinkles are formed. Vertical wrinkles are formed over here, right? So this is all about your corrugated superciliary, and I think we have finished about the orbital part of your facial muscles. So next two more parts we have got. What are these two more parts? One is called as a nasal part, another one is called as a oral part. But before we jump into that, let us discuss the clinical part. What is the clinical part over here? For example, what did I tell you? All of them are innervated by the facial nerve branches. For example, if the facial nerve itself is paralyzed. So when there is a damage of the facial nerve, what can happen? Your orbicularis oculi will not work. At the same time, your corrugator supercilii also will not work. If your orbicularis oculi and corrugator supercilii are not working, do you think your palpebral part, orbital part and lacrimal part will work? It will not work. When these three parts are not working, can you close your eyes? You cannot close your eyes. Your eyes are all the time open. So when your eyes are all the time open, this is what it will result in, right? So when your eyes are all the time open, what will happen? There will be a lot of dust, a lot of dry air that will be deposited in the eyes, and your entire eye will be inflamed. This condition you call it as exposure keratitis. Okay, right. So let us just write it down. For example, if there is paralysis of your orbital muscles. Orbital muscles means the two muscles which we discussed. Orbital muscles. Why? Because of facial nerve damage. Because of facial nerve damage, then what will happen? The eyes cannot shut. Eyes cannot shut. So if eyes are not shutting down, if you are not able to close the eyes, this condition where again the dust everything will be deposited over here, you see this condition over here is called as exposure keratitis. So this one over here is called as exposure keratitis, right? Next important, Next important thing is that there is also one more thing over here. What is exposure keratitis? What is exposure keratitis is that you see this redness over here. This redness is called as exposure keratitis. But in this patient, you see only the lower eyelid is dropping down, right? For example, if the palpebral part is not working, then only this lower eyelid will drop down. So when lower eyelid is dropping down, what will happen? Again, what will happen? Exposure keratitis. So if only lower eyelid is dropping down, this condition you call it as ectropion. Okay. So there can be two things that can be associated with facial nerve damage. One is the entire eyeball cannot close, right? You cannot close your eyes, right? That is called as exposure keratitis. And second important thing is patient will specifically have lower eyelid drooping. So when the lower eyelid droops down, this would lead to a condition called as ectropion. This would lead to a condition called as ectropion. So this condition over here is your ectropion. Okay, right. So let us discuss. We discussed that these two muscles are innervated by which nerve? Facial nerve. So exactly which part of the facial nerve? I did not tell it as facial nerve. I told facial nerve branches. Now let us discuss in Orbicularis, Oculi and corrugator exactly which nerves of which branches of the facial nerve are innervating. Orbicularis, oculi and corrugator supercilii muscle. So orbicularis oculi is your temporal and zygomatic branches of facial nerve. Zygomatic branch of facial nerve and corrugator supercilii is your temporal branches of facial branches of your facial nerve, right? Now after the discussion of the orbital part is done, now let us discuss what are the nasal part. Okay, what are the muscles that are supplying the nasal region? So the nasal group. Nasal group of muscles. So in the nasal group of muscles, we basically have got four important muscles. So what are these four important muscles? One is called as nasalis muscle, right? So this is called as transverse nasalis. And the other group of muscle is, other one is also called as nasalis, but this is not transverse, this is called alar or alar group of muscle, right? So alar nasalis, another one is called as transverse nasalis. And the next third important muscle is here is called as your procerus muscle. Procerus muscle. And the fourth group of muscle over here is your depressor septi nasi muscle. Depressor septi nasi muscle. So what is depressor septi nasi? Depressor in the sense depression. Depression of what? Septi nasi in the sense nasal septum. Depression. This is your nasal septum. So depression of your this is depression of your nasal septum. That is done by this depressor septi nasi muscle, right? But anyways, we shall discuss them anyhow. So here itself I will write down the nerve innervation so that it would be easy for you. So the nerve innervations is that all these muscles are innervated by buccal branches. You know, facial nerve has got what branches? Facial nerve has got, we just discussed here, temporal branch, it has got zygomatic branch, right? Now I am discussing all of these are innervated by the buccal branches. Buccal branches of the facial nerve. So all of them are innervated by the buccal branches of the facial nerve. Right, the first important muscle which we shall be focusing on in the procerus muscle. So all of you look at this. So this muscle over here is called as procerus. You see here, this muscle over here is called as your procerus muscle. If you look at the action of this procerus muscle, what does this procerus muscle will do is that this procerus muscle will, look here, it is pulling the eyebrows downward like this. Okay, so what does it do? It pulls the eyebrows downward. So it pulls the eyebrows downward. So when it is pulling the eyebrow downward, what kind of wrinkles you see? Vertical wrinkles or transverse wrinkles? You see transverse wrinkles. You see transverse wrinkles. Where do you see? Over the nose. Transverse wrinkles over the nose. For example, this is the, whenever you smell something bad, this is how you put, right? So in this way, you are pulling this part down here, you see, and you see transverse wrinkles that are formed, right? So this is done by this procerus muscle. Next, after this procerus muscle, the next muscle, so this is your procerus, the next muscle over here, if you can see, you see this muscle located at the level of maxilla, right? So this muscle over here is called as depressor septi nasi muscle. Depressor septi nasi muscle, right? So this depressor septi nasal muscle, where does it originate? It will originate in the maxilla. Okay, so it will originate from the maxilla, and where does it insert? It inserts to the nasal septum. Okay, you see this is the maxilla, it originates in the maxilla and goes up and inserts to your nasal septum. So from here it is going up and inserting to the nasal septum. So this is how it will insert, you see, this is how it will insert. So where it is inserting to nasal septum, inserts to nasal septum. Okay, so what is the function of this muscle? The function of this muscle is that, so it will pull this nasal septum downwards. As a result, the nasal openings are widened. Okay, so it will pull nasal septum downward inferiorly, downward or inferiorly, to widen the nasal opening, to widen the nasal opening, to widen the nasal opening. Okay, right. Next important muscle here is nasalis muscle. Now coming to this nasalis muscle, I told you coming to this nasalis muscle, I told you two important things. So what is the important thing I told you? Nasalis muscle has got a transverse part, it has got an alar part, right? So if you look at the picture over here, right, if you look at the picture over here, this part over here is your transverse part. You see nasalis transverse, and here you have got nasalis alar. It means, see, this part is the nasalis transverse part, and down here you have got the nasalis alar part. So what is nasalis transverse part used? This nasalis transverse part will close the openings of the nose, and nasalis alar part will open. See now, you see both my nasal openings are open like this. You see, so this opening is done by your nasalis alar, and this closure of the nasal openings are done by your nasalis transverse muscle. Okay, so this nasalis transverse muscle, what does it do? It compresses the nasal openings. Compresses the nasal opening, and nasalis alar, this will widen the nasal opening. Widen the nasal opening. Okay, so this is the nasal part. Now after the nasal part, the next part we shall be discussing is the oral part. Okay, oral part of the facial muscle. So what are the different, we shall discuss the oral part. So now we shall discuss about the oral group of muscles. So what are the oral group of facial muscles? So oral group of facial muscles are basically three. Okay, so what are these three groups? One is called as Orbicularis Oris. This time it is Oris. Previously it was Oculi. Orbicularis Oculi. This is Orbicularis Oris. Orbicularis Oris. After Orbicularis Oris, the next muscle you have here is called as a buccinator muscle. Buccinator muscle. And next you have got the minor oral muscles. Small oral muscles called as minor oral muscles. Okay. So first important thing is, what is this Orbicularis oculi? Orbicularis oculi is innervated by which nerve? Again, Orbicularis oculi is innervated by the buccal branches of facial nerve. Buccal branches of facial nerve. In the same way, buccinator is also innervated by your buccal branches of facial nerve. Now, when I tell minor oral muscles, what are these minor oral muscles? These minor oral muscles are also divided into two groups. What are these two groups? One is called as a lower group, another one is called as a upper group. So, one you have got is the lower group, another one you have got is the upper group as well as the lower group. So, what are the lower group muscles? Just remember them as DAM, D-A-M, DAM. Okay. What is D stands for? D stands for depressor labii inferioris. Depressor labii inferioris. A stands for anguli oris, and third M stands for mentalis. Just remember it, you need not to identify these muscles, it is not important, just remembering the names is enough, okay. Now, next important thing is coming to the upper group. Now, in the upper group, how do you remember these muscles is that you just remember the mnemonic laser, L-A-Z-R, laser, okay. Now, what does L here stands for? L here stands for levator labii superioris. So, previously it was labii inferioris, now it is superioris, okay. So, it is levator labii superioris, okay. Next, what does A stands for? Levator anguli oris. Previously it was just anguli oris, now it is levator anguli oris, okay. Next, what does Z here stands for? Zygomaticus muscle. So, there are two zygomaticus muscles, one is called as zygomaticus major, another one is zygomaticus minor. Zygomaticus major, another one is zygomaticus minor. So, there are two muscles, zygomaticus major and minor. And the last one is R. R stands for risorius. R stands for your risorius muscle. So, how many muscles over here? One is labii superioris, anguli oris, zygomaticus major, zygomaticus minor as well as risorius. Right. So, if you look at the first muscle here, this muscle over here is called as your orbicularis oris. See this one. The first muscle is orbicularis oris. So, this one over here is called as your orbicularis oris muscle. Okay. What is the use of this orbicularis oris muscle? This orbicularis oris muscle, it will close the lips. For example, like this. For example, whenever you are kissing someone in this way, right? So, all these muscles, both the lips are coming together, right? So, that is the responsible for this orbicularis oris. So, what does it do? It is responsible for closing the lips. So, it closes the lips to narrow the oral opening. Closes the lips to narrow the oral opening. Okay. So, this is the one. You see, she is closing the lips to narrow her oral opening. Right here is called as your orbicularis oris. Orbicularis oris. And next important muscle you can see in the buccal region, right? So, this is called as buccinator muscle. So, let us just revise what are the things we have just discussed, guys. We started our discussion with the muscles over here, muscles of the facial region, right? Orbital, nasal and oral. Orbital we have discussed two, one is called as orbicularis oculi, another one is orbicularis supercilii. In this orbicularis oculi we have got palpebral part, orbital part and lacrimal part. Palpebral part is just present in the palpebra. It is useful for your gentle closure of your eyes. Next we have got the lacrimal part over here, that is responsible for the drainage of your lacrimal fluid. Third one you have got is a orbital part, that is useful for the tight closure, right? So, next important thing, these are the important, this is called as a corrugator supercilii that brings both your eyebrows, draws both your eyebrows together, which will give this pattern. These are called as a vertical wrinkles, okay. Next, paralysis of these muscles will lead to is done by this facial nerve damage, right? Eyes cannot shut, exposure keratitis, and the lower eyelid is drooped down, this is called as ectropia. Next, coming to the nasal group you have got nasalis, one is transverse and alar. Transverse is responsible for the closure of your nasal openings, alar is responsible for opening of your nasal openings. We have got next procerus and depressor septi nasi. This is your procerus. This will pull the eyebrows down, which would lead to this particular facial expression, that is transverse wrinkles. Okay. So that is the thing. We have discussed all of these things regarding the muscles of the facial expression. So thank you so much for watching my video. Goodbye.